Now, function of the angiotensin II. This is the total renin-angiotensin system. First, there is the formation of the angiotensinogen, which is produced in the liver. Then, by action of the renin, which is produced mostly in the kidney, and it convert angiotensinogen to angiotensin 1. Angiotensin 1 then converted by the ACE, angiotensin converting enzyme, which is mostly produced in the lung endothelium, and conversion of the angiotensin 2 occurs. Angiotensin 2 then breaks by the different aminopeptides to angiotensin 3 and angiotensin 4. These angiotensin 3 and 4 are also have some action of like the angiotensin 2, and angiotensin converting enzyme also acts on the bradykinin and it forms the inactive metabolite. আমি এটা আগের ক্লাসে বলেছি। Now, function of the angiotensin 2. Angiotensin 2, first it acts on the blood vessel. Here the receptor is the AT1A and it causes the arteriolar vasoconstriction. This causes the arteriolar vasoconstriction and thus it increases the BP. Main function of the renin-angiotensin system is it controls the arterial blood pressure. Then it acts on adrenal cortex, which causes increased aldosterone secretion. In adrenal cortex, in case of formation of the steroid hormones, it acts in two sides. Number one, it acts on cholesterol and helps in formation of the pregnenolone. These steps it acts in early stage and also late stage at the corticosterone to aldosterone. In two steps it acts. Now, aldosterone increased aldosterone causes increased excretion of the potassium, and it also increases reabsorption of the sodium and water from the distal convoluted tubule and collecting duct, and this causes the increased BP. Kidney, and in adrenal cortex the receptor is AT1B. Angiotensin 2 acts on kidney and it causes the constriction of the efferent arteriole. Efferent arteriole constriction, what occurs? It causes the increased filtration fraction. There is the glomerular capillary pressure increases and causes the increased filtration fraction, and there is a decrease of the peritubular pressure, and this decreased peritubular pressure causes the increased reabsorption, and both these action causes the increased BP. In kidney, it also directly stimulates sodium reabsorption from the PCT, from DCT and the collecting duct, and it increases BP. It directly stimulates the angiotensin receptor present in the different part of the kidney. This is the angiotensin receptor. Angiotensin 2 acts on this and it stimulates the first it is sodium hydrogen ATPase, then sodium potassium ATPase and sodium bicarbonate co-transporter. Next, it acts on this increased reabsorption of the increased sodium reabsorption causes the increased BP. Then it acts on postganglionic sympathetic nerve and causes the increased release of the norepinephrine, and which causes the increased BP. Angiotensin 2 acts on the mesangial cell and which causes the mesangial cell having the contracting power and which decreases GFR and which increases the BP. Angiotensin 2 acts on heart and it has a positive inotropic effect and increases BP. In brain, angiotensin 2 acts in different fashion. It not passes through the blood-brain barrier. Angiotensin 2 cannot pass the blood-brain barrier. It acts on via the circumventricular organ, that is subfoundation organ and OVLT. In brain, it decreases baroreflex sensitivity and thus increases the BP and by increasing the pressure effect. It acts on the hypothalamus and increases thrust, increases ACTH and increases ADH, which causes the increased BP. এই চার্টটা তোমরা খুব যত্ন করে রেখে দেবে, এটা আমি অনেক কষ্ট করে তৈরি করেছি, পুরো এই ব্যাপারটা এখানে আছে। অ্যাপ্লাইড persistent increase angiotensin 2 permanently causes the persistently increased BP. কারণ আমরা দেখলাম যে angiotensin the all the functions of angiotensin is ultimately there is the increased BP. So increased angiotensin 2 causes the increased blood pressure. And treatment key angiotensin converting enzyme, either angiotensin converting enzyme inhibitor or angiotensin receptor ARBS, which is the angiotensin receptor blockers. Angiotensin then prostaglandin inhibitor আমরা we know that prostaglandin increases stimulates the release of the renin. So prostaglandin inhibitor like indomethacin decreases renin release. Beta adrenergic blocker, that is sympathetic blocking, that is the propranolol decreases renin release. Renin inhibitor, that is enalkidine, it decreases angio 1 formation. Angiotensin converting enzyme inhibitor, that is captopril, enalapril, ramipril, which prevent formation of the angiotensin 2. Saralazine is the competitive inhibitor of the angiotensin 2 and it also causes the decreased blood pressure. Angiotensin receptor blockers like the losartan acts on the angiotensin, mostly acts on the angiotensin 1, and azilsartan mostly acts on the angiotensin 2 and they are used as a antihypertensive. Tissue renin angiotensin system. Many different tissue like blood vessel, heart, uterus, placenta, eyes, fat, testes, ovary, pituitary contains the independent renin angiotensin system and they generate angiotensin 2 and it acts for the local use. Angiotensin 2 is a significant growth factor in heart and blood vessel. So now angiotensin converting enzyme inhibitor, ACE inhibitor and ARBS is now used in treatment of is the treatment of choice in congestive cardiac failure for inhibition of the growth effect of the angiotensin 2. Fetal renin angiotensin system. Here the fetal renin angiotensin system is mainly sodium losing system, as angiotensin 2 has little effect or no effect on the aldosterone release, and angiotensin level is high, renin level is high but angiotensin 2 level is low. Why? As the lung is immature and angiotensin converting enzyme is not produced. Role of renin in clinical hypertension. Is one kidney gallbladder hypertension is when one kidney is removed by other kidney's renal artery is clamped. It occurs in transplanted patient or in bilateral renal artery stenosis. It causes the decreased blood flow and causes the increased renin release and increased angiotensin 2. There is the increased aldosterone and it causes the increased BP. So when there is decreased blood flow, there is the increased renin release and at the constricted kidney, and this causes the increased angiotensin 2 and increased aldosterone and increased BP. 2 kidney gallbladder hypertension. One kidney is normal, other kidney is clamped. It occurs in unilateral renal artery stenosis. ischemia of the one kidney causes increased release, it goes to circulation. Renin is released into circulation, it affects the normal kidney and increased BP. It also occurs when one kidney, a part of the one kidney is affected, and this part causes the increased renin release, and this affects the normal JG apparatus and kidney part, and which causes the vasoconstriction of that part, and this causes the increased blood pressure.